Good afternoon, everyone. Welcome to our virtual news conference for the city of Grand Forks. Just a little bit of housekeeping duties like we did yesterday. Once we get to the Q&A portion of this presentation, please use the raise hand feature within the Zoom meeting, and we'll call on you. KNOX, I'm looking at you. We'll see how that works as far as feedback. If not, we can use the chat function again as well. Hopefully that got resolved yesterday. To those participants, I see Dr. Deere has provided his video feed. Mayor Brown, I see you're connected. Can you please turn on your camera and so people can see you? Yes, thank you to Ms. Swanson, Mayor Brown. Well, you got to flip your iPad around there a little bit or sideways. Thank you very much. Okay, so with that, I'm going to turn it over to Mayor Brown. And hold on one second, Mayor, and we will get opening comments as he gets his camera set. Thank you there, Mayor. Perfect. All right, Mayor, I got you switched on there. I got you on, and Mayor Brown, the floor is yours.
Okay. Well, good afternoon, everyone, and thank you for tuning in. Being informed, working with facts and fact information, and continuing to work together as a community is how we're going to get through these difficult times. We're in this for the long haul. We should expect months, and so we're already focusing not just on today, but on the next phases to come. I support Governor Burgon's executive order addressing restaurants and bars statewide. The governor's executive order also directed the closing of recreational entertainment facilities. Our mission is to protect and serve the residents of Grand Forks and the state of North Dakota as a whole. All of us need to practice social distancing, and these steps are taken to limit opportunities for congregating. We understand there are questions surrounding the specifics of implementation of the government's executive order from last night. We expect that there will be updates and direction from his administration, and we'll wait for further details at 4 o'clock. My guidance for churches and other businesses like salons, spas, and barbershops is as follows. Take action with the safety of your employees and patrons as the highest priority. Follow CDC guidelines, adjust your hours, practice social distancing, sanitize everything frequently, and consider temporarily suspending services to the public. I will not mandate the closure of these entities at this time, but strongly encourage them to take the above recommendations seriously. The governor's been leading on the state level, and I, as mayor, is prepared to take additional action if necessary to protect the residents of Grand Forks. We must be united to flatten the curve of the COVID-19 in our community. Our friends and neighbors and loved ones depend on us to exercise personal responsibility in these extraordinary times. I understand this is uncharted territory and a very difficult time for our local businesses and their employees. We're in the midst of a health crisis and at the same time an economic crisis. The city has a strong relationship with local partners like the Chamber and EDC. The infrastructure is in place, but their priorities have changed. We're all in contact with the governor's office, commerce, and federal partners to do everything we can to make sure business continues. I applaud all the businesses who already acted proactively and have taken a heavy heart for all the tough decisions owners are having to make. These are serious times that require serious decisions. I urge all the citizens of Grand Forks to support our businesses by utilizing drive-through, takeout, and delivery services when possible. I had my takeout pizza for lunch, and I'm looking forward to more. We are grateful for local businesses as well as community partners for stepping up in multiple ways in our community's time of need. We have created a page on the city's website where you can find community resources, including food, grocery resources, home utility resources, and local business response assistance at grandforksgov.com/resources. Over the weekend, we'll be working with our collaborative partners in all policy areas like schools, housing, nonprofits, and businesses to get actionable solutions in these areas during these challenging times. We will keep you updated. Again, I want to assure everyone that the city is continuing to exercise its mission to protect and serve. The flood action plan is being implemented, and we'll be ready for whatever comes our way. Mr. Field will be providing a quick brief summary on those activities. As you saw yesterday, streets are being plowed and garbage is being picked up. Our public safety departments like police, fire, and PSEP are continuing to execute their mission to keep us safe. We have closed our buildings to the public for the safety of city staff and the public, but we are still doing business. I encourage all residents to utilize our virtual city hall at grandforksgov.com/virtual to fill out applications, pay bills, and apply for permits. These are extraordinary times. I cannot stress the importance of personal responsibility enough. We need to take these actions for each other. Together, united, we will overcome this. Thank you.
Thank you, Mayor. Also on the call here, I'm sorry, I should have prefaced Mayor Brown obviously giving his statement, and then also we will hear from Altru and Dr. Josh Deere. Also on the line, not expecting to make a statement, but available to answer questions, Mr. Todd Phelan and Ms. Deb Swanson from Grand Forks Public Health, Todd Phelan, City Administrator. So next, we'll head over to Altru and get to Dr. Deere. Hold on one second, Josh. We'll get you all situated. Go ahead, Doctor. There you go, Doctor.
All right, so you can hear me? Thank you. So we're here today to discuss again from a community perspective what we can do as a city, Department of Health, and health system for how we can combat COVID. We continue to press on with our daily operations as usual at Altru in quite a different time. Our phone call volume yesterday again on the COVID line increased. We continue to screen patients as the North Dakota Department of Health guidelines change in guidance from them. We're limiting visitors to one, as I discussed yesterday. We're working around the clock 24/7 in our command center. We're continuing to practice social distancing, frequent hand hygiene, washing surfaces more often, including doorknobs and table surfaces. And from a personal perspective, our lives are changing. I mean, I haven't seen my wife very much in the last couple of days, or kids, but I think the work that we're doing here at Altru Health Systems is very important. And we continue to support our community partners, as well as other regional hospitals as they look for guidance from both us and the state. And we're having talks on a daily basis about how we can pool our resources to combat COVID the best we can locally. So thank you for this forum again, John.
Thank you, Dr. Deere. As we sit here, wasn't expecting any prepared comments from Mr. Phelan or Ms. Swanson, so we will open the floor up for questions from the media. And please use the hand raise, and we have one right here from Mr. Joe Bowen.
Oh, can you guys hear me? All right, cool. How many testing kits does Altru have available at the moment?
Dr. Deere, did you hear that question? The question was, how many test kits does Altru have at the moment? I will get you unmuted. Go ahead, Doctor.
As it's changing by the hour, I don't have the specifics, but what I can tell you is we are responsibly prepared with the limited number of tests, both locally and nationally. This isn't just an Altru problem. To accurately test and diagnose patients that have concerns over COVID, particularly those who are at the highest risk. The North Dakota Department of Health is changing the recommendations, and we're making sure that our testing supplies are in line with the needs that we're going to need in the future.
Another question from Mr. Joe Bowen from the Grand Forks Herald. Go ahead, Joe.
Hello again. So do you have a number, even a ballpark one?
Go ahead, Doctor.
No, we don't. As I said, we're actively managing the situation, and we feel that we are at a safe spot for the patients that we are planning to treat in the coming weeks and months.
And Joe, did you have another question?
I have quite a lot. What is the requirements for getting tested for the coronavirus? What sort of, like, how do you guys decide who gets a test? Presumably.
Sure, go ahead, Doctor.
Yeah, so how we decide who gets a test really is dictated through the North Dakota Department of Health. At this time, the testing is more limited, and that's understandable. If you think about it, if we screen every asymptomatic patient right now that wants a test, we aren't going to have the needed tests for those that really need it the most. And the people that need it the most are those who are admitted to the hospital and have serious illness, those who have exposure and other risk, and those who are in the healthcare field. So we need to make sure that we're testing those populations, both from a patient and community perspective. If we have staff that are also ill or carriers of the COVID, we want to make sure we have testing available for those people so that we can be properly quarantining and reducing the risk for our community and as a whole.
Thank you, Doctor. Any other questions out there as I'm looking for a raised hand? There's, sorry about that, Joe. You said you had quite a few. So
yeah, quite a lot. I put out a thing on Facebook and Twitter and said, hey, what questions do you want me to ask? And now I have a 5-page Google Doc. So I guess I have one more question, I guess, on the healthcare side of things. And that is, how many tests have you guys administered in Grand Forks?
Go ahead, Doctor.
Yeah, I don't have the specific number in Grand Forks, but I know that our health system, as of this morning, 7 a.m., we've screened over 200 patients through our COVID hotline and our curbside screening and screening throughout clinics that have appropriate patients who had met criteria at that time.
Thank you, Doctor. Go ahead, Joe.
Oh, yeah. Sorry, I just want to make sure I'm not steamrolling anybody here. Let's see here. Do you feel that Altru has enough personal protective equipment if infection rates rise in the area?
Doctor.
Yeah, at this point in time, we have enough PPE or personal protective equipment and are in constant communication with our state health department on supply availability. However, this is a national shortage, as I said, and actually not just national, a worldwide shortage. And you do hear about this on the news in places that are further along in the COVID outbreak than we are. So this is something we're actively managing, and we're managing responsibly.
And before I go back to Mr. Bowen with the Grand Forks Herald, to your point, Joe, we'll get back to you. Don't worry. Does anyone else have any other questions, or should we have Mr. Bowen continue to go through his list? I don't see any hands raised at this time. So, Mr. Bowen with the Grand Forks Herald, I have opened your mic. Continue down your list.
All right. So this is me kind of consolidating a few different questions, but basically, as people come back from, say, spring break, or maybe they're a snowbird coming back from another state, is there anything they should be doing once they get back to town? Should they be self-quarantining? For how long? What should they be doing?
I'm going to start with with Dr. Deere on this one, and Mrs. Swanson, if you would like to jump in on this one, just let me know. But we'll start with Dr. Deere.
I think you're going to hear the things that we all say, and the president's been saying, our governor's been saying, our local health department has been saying over and over, is that we are wanting those people to self-quarantine right now for 14 days. Also, hand washing, the coughing into your elbow, personal distancing, those are all things that these people should be doing.
Thank you, Doctor. I'm going to get it over real quick to Deb Swanson. Deb, do you have any comment on this question at all?
Yes, I do. Thank you, John, for the opportunity to add a perspective from the Grand Forks Public Health Department. We too are concerned about the possibility of students and others returning to the community perhaps after spring break from all of our higher education institutions or others that are traveling. We have a location on our website where they can go and complete a survey, and the information will go to the North Dakota Department of Health, and they will get information and advice as to the areas that they've traveled and whether they're high risk. I also want to point out that there are a number of ways to communicate with Altru, with Grand Forks Public Health Department, and with the State Health Department. For Grand Forks Public Health, you can call 787-8100, Monday through Friday, 8 to 5. for questions related to testing or any other questions related to coronavirus. All-True Hotline is limited to people who have symptoms and want to know if they should come in and be tested. And that number is 780-6358. Also, we are taking messages on our website, and that address is health@grandforksgov.com. We do implore the public to please follow the guidelines for social distancing. It is extremely important at this time, especially as we add additional venues where people will be limited access or no access. We understand this is asking a lot of people, but it is really our best public health tool to preventing the spread. Once again, back to the issue of college students or others returning to the community, we strongly encourage that they get in touch with their institution. UND has been reaching out to students, advising them that they do not need to come back to campus until April 6th. They should check the UND coronavirus blog on the UND website for more information. And I would say the same is true for any other institutions.
Thank you, Deb.
John, this is the mayor.
Yes,
So,
Mayor.
Where you visit is important, but when you come back to Grand Forks, you go through the same airport hubs as everybody else who's returning home, and you're exposed to everybody who went everywhere in this country or the world. So I find it interesting. Yes, where you went is important, but also realize you've been exposed along the journey home. So I would strongly encourage that you do follow the guidelines and self-isolate.
Thank you, Mayor. Joe, I'm going to go back to you. I don't see any other hands raised. Go ahead, Joe.
Hello, and let's see here. There are a whole bunch of questions about childcare. Is there a plan to close them, and should they be open right now?
I'm aware of no plans to close childcare, and I would want the children in our community to be at daycare rather than to be with their grandparents. So I think right now that's our safest alternative. And I hope that they're continuing to use this, the safe practices of frequent disinfection and social distancing and other practices that we've responded to. But I do think that's the safest alternative we have at present.
Anyone else like to comment on the daycare issue at all as I look at our panelists here? No? Joe, go ahead.
Hello, so then just to clarify, if I run a daycare, I don't, but if I did, I would not be under an obligation to close as of yet, correct?
That is our understanding. Mayor, would you like to comment on that, please?
I did.
Okay,
I said,
yeah.
I think it will follow the guidelines of the governor, but right now K through 12 is closed. Daycares are exempt at present. Childcare, excuse me.
Yes. Joe, anything else? How far are we getting down your list?
Pretty far. I'm trying to consolidate here. I got a lot of them about 15 minutes ago or so. Is there a plan in place to forgive or give more time on housing and rent payments?
If it was
Go ahead.
Oh, that's not in our jurisdiction. That would be up to the individual landlords. But if it's city housing, we may look at that. But otherwise, it's not in our purview.
Is there anyone else who'd like to comment on that question? Mr. Phelan is raising his hand. Todd, go ahead.
John, and to that question, I think the mayor discussed on his earlier statement that we are going to be convening in several different policy areas to include housing. And so the mayor will be convening these policy groups to include housing with other organizations like the EDC and the Chamber and others. And so I think there'll be further conversations of what we can do as part of a community, developing public policies, and as we move forward in this area. Thank you, John.
Yep, thank you, Todd. I see a hand raised here from KNOX. We'll see how this works this time. Go ahead, KNOX.
Hopefully it'll work. This is a question regarding the testing that has been done as far as people who are dealing with, they may feel like they're symptomatic of coronavirus or COVID-19. To go back to clarifying on that, I know that the screening has been done, Dr. Deere. There's some questions that we've received. Has there actually been tests or a test that has been sent into the state lab, or the actual swab test that's been done on anybody in or through the Altru system at this point, or has it all been screening through the hotline and the curbside screening?
Dr. Deere. Oh, hold on. Doctor.
Yeah, so that's the test number that I gave earlier on the question. So those are all done through Altru. That Altru is doing the curbside testing. So that number that I gave you of greater than 200 is accurate. And that's what we've done as a health system. All of the testing from a technical perspective is done at the state level though. So it has to get to the state lab to be run.
Okay, and KNOX again?
Just to follow up on that, so you have sent tests into the state lab at this point, correct?
Dr. Deere.
Yes, over 200.
All right. Thank you, Doctor. Are there any other questions? Joe, I'm going to jump back to you. I don't see any hands raised. Joe, did we get through your list?
No.
Okay.
This is probably, I have a lot of questions about schools as well, but I know nobody here is a school district employee. How hard would it be to get somebody like Terry Brenner on these calls?
I can answer that. Oh, Mr. Phelan can answer that. Go ahead, Todd. Let me get you on there. Go ahead, Todd.
John, on that question, and we discussed this earlier with public information, is that we have reached out to the school district and Dr. Brenner, and they are kind of really finalizing their plans regarding the kind of the education delivery method that they are required to have. And Dr. Brenner, you really provide some reassuring words to me this morning that they're well on their way to accomplishing what the governor has given them as homework here in the Grand Forks School District. And importantly, he said next week he would be glad to join these virtual press conferences and provide the school story also. Thank you, John.
Thank you, Todd. I see a question here from KNOX again. Go ahead, Ryan.
Thank you. Mayor and Mr. Phelan, could you just address again the shopping situation for people in Grand Forks? We understand there's still a lot of pressure that's being put by shoppers hoarding certain products or mass buying certain products. I know throughout this, the mayor has said, listen, the supply chain is going to be there. The grocery stores are going to stay open. Is there any reason why that has changed at all? Would you advise people that they should be stocked up on certain items or not? Or do you expect business to go on as usual at the grocery store and I guess daily item level?
We'll start with Mr. Phelan on this one.
Yeah, Ryan, I think as Hugo's really has been out front on this, is that they really are, the supply chain is good. They're getting things on a daily basis. And so there's no need for hoarding at this point. The supplies are good. They're getting things in daily. And we've heard that from other retail stores too, like Target and Walmart, that they continue to get shipments even to Grand Forks. And there's no need for hoarding of goods.
Mr. Mayor, would you like to comment on this one?
I would encourage people to have 3 months supply of medication on hand so that we can be prepared for whatever comes our way.
Okay, any other questions there? Thank you, Mayor. Any other questions, Mr. Bowen?
Hello again. Are there any plans in place for like alternative hospital areas? And by that I mean like excess. Like if there's too many people for Altru to handle at once, are there plans in place to say use like a high school gym, or the example this person used was train cars, but something along those lines?
Mr. Deere, if you could maybe tackle this one first.
Yeah, we currently feel we're prepared to handle the volumes. As you know, with COVID, that can change on a day-to-day, hour-to-hour basis. We have been discussing through our command center what happens if that were to occur. And in times like that, we'll be reaching out to our community partners, regional partners, to figure out how we safely care for a surge that we're seeing in other parts of the country.
Thank you, Doctor. Deb, would you like to take answer this one as well? I'm going to unmute your mic.
Yes, thank you, John.
Go ahead, Deb.
We know that our state health department has a pretty good supply compared to other states in the nation care for our population should we need. And surge capacity is what happens when hospitals need to expand beyond the borders of their physical environment. Our state health department has a lot of pre-positioned assets, and our department is in charge of maintaining some of that here in Grand Forks. Now, granted, if the surge capacity is needed all over the state, that will be challenging, and we'll have to deal with things on a local resource allocation. But do know that our state is a little bit more prepared than some other states to take care of additional ICU beds and that minimal level of care that might be required to move people out and keep those that are the most acutely ill within the hospital.
Thank you, Deb. Looking for a hand raise for Mr. Bowen, you're up.
Hi again. Are there any anticipated restrictions for individual mental health services? Like,
Sorry, Joe.
Sorry. Like, am I allowed to go to a therapist? Right. At present, I assume I am. But do you anticipate any restrictions there?
Deb, would you maybe be able to address this one to start? Or I'm not sure. I see Josh raising his hand. Dr. Deere, we'll go to you first. Thank you.
I think that's a great question, because we realize and have seen from the pandemic starting somewhere else and coming to here kind of last, the toll that this takes on patients and families from a mental health perspective. So at least in our area, we're focusing on getting our virtual care as robust as it can be, so patients can continue to connect with their providers, therapists, and whoever else they need to support those type of services.
Thank you, Doctor. I'm looking at Deb Swanson again. Deb, do you have any input on this question at all?
Yes, I would agree with what Dr. Deere previously stated. We do know that the social isolation can have an impact on the population without acute mental health needs. And so we know that those who already have existing conditions will need our care. And that will be in a variety of ways. And I cannot stress enough how important it will be for us to be able to provide that care, for operations to be able to continue in behavioral health for the patients that need it. That might be telephone, it might be virtual, it might be a variety of ways, it might be texting. But we know that we will have to use whatever creative means that we have available to us to ensure that our behavioral health needs are met. And that's for the general population as well. Everyone is experiencing some stress right now.
Thank you, Deb. Looking for a hand raise here. We've had an additional person calling out with I realize if you're on a computer, you can raise your hand. I do see one individual on a phone. Do you have, you can unmute your phone if you have a question and jump in. Feel free to do that. Joe, I'm just going to touch, you said you had a long list. Joe, have we covered your questions?
Yeah. All right. Let's see here. We're getting into the more esoteric ones here. Someone's asking about marriage licenses. They want to get married in case things go sideways. How do they get one if City Hall shut down?
Okay, not gonna lie, that's a one I wasn't expecting. I'm sorry, Deb. I will get to you. Go ahead, Deb.
That's a function of county government, and county is in the process of making plans to communicate with the public about how their operations will continue, whether it's a marriage license or a passport or anything related to their taxes. They're all working on virtual systems to make that happen.
Thank you, Deb. I see the individual on the phone has unmuted their phone. Please go ahead on the phone.
Yeah, this is Neil Carlson with iNews. Getting a lot of messages from employees around the region. I'm not sure who wants to maybe take a stab at answering this, but can you give any guidance to employees and large employers, especially those at manufacturing and production plants, where sometimes there's 1,000 people at one shift in close proximity to each other? Any guidance for those employees and or employers at the large production plants?
Mayor Brown, I see you chomping at the bit on this one. Go ahead.
Well, right now, our community faces three challenges. We have the COVID-19, we have the upcoming flood fight, we also have a pending economic crisis. So with the COVID-19, we have guidelines from the governor, departments of health for what we can follow. The flood fight, you'll see things happening on the Greenway. If you go to the National Weather Service website, you'll see certain actions we take at certain depths where we're being proactive in some of the low-lying areas so that we won't be scrambling at the end to protect our community. The third thing, we have the economic crisis facing our community. We have business listening sessions coming up next week. And we have on Monday, we have food and groceries, restaurants, similar establishments. Tuesday, we got to talk about retail. Wednesday, we're going to discuss manufacturing. Thursday, we're going to discuss professional services. And all these will be done with the assistance of the chamber and the EDC. And I understand that we have information from the governor's office about unemployment and how people can apply for that. So Todd, I'll turn it over to you.
Go ahead, Todd. Oh. Hold on, Todd, 1 second. It's not allowing me to unmute you. There you go. Go ahead.
Okay. There's going to be more guidance coming out from the state government, federal government, and we know Congress is going to pass a stimulus bill of some sort. The state government is moving forward with some proactive programs regarding small and business and the like. And I think as the mayor just said, there'll be more and more information coming out next week to include listening sessions, and not only important to have listening sessions, but to have answering sessions so people have some predictability and actions that can be taken sooner rather than later. So more coming. We're going to organize ourselves over the weekend, get these policy areas organized, and then develop some action plans for next week.
Thank you, Todd. Neil, did that answer your question? I see your mic is still open.
Thank you.
Okay, I'm going to mute you. And I'm going back to, I don't see any hands raised. My default, excuse me, has been, go ahead, Mr. Bowen.
Yeah, hey, long-time listener, first-time caller. If it comes time to start differentiating between essential and non-essential businesses, you know, maybe non-essential ones need to close. What is a couple examples of an essential businesses? What businesses would be considered essential, as far as you guys know?
Mr. Phelan, I'm going to start with you on this one, okay?
Sure. I think essential businesses are grocery stores, pharmacies, obviously clinics, healthcare facilities, things that we need to continue to move forward as humans day to day. And those are the things that would be essential services among others.
And Mr. Phelan, is it fair to say that it is a bit of a moving target? If we're in the middle of a flood fight, our public works becomes a pretty essential business as well from a city standpoint.
Absolutely. So, you know, certainly we have essential services, but, you know, from a business perspective, those are a handful of things that are essential. And not only essential for us, you know, we need to buy supplies and move forward with things too.
Okay. Thank you, Todd. Thank you. Mr. Bowen?
Yeah, we're getting near the end of the list. I've also been skipping around, so I'm not sure which ones I've already answered or asked already. But do you guys have any plans to send push alerts to people's phones if there's an announcement like that? So far, a lot of it's been kind of this sort of virtual press conference and city websites. But do you have any plans to, you know, maybe my phone buzzes same way like there's like an Amber Alert sort of thing if there's something important?
I'm defaulting here to Mr. Phelan again. Go ahead, Todd.
Sure. And John, you can help follow up on this. We do have like code red alerts and things that we do push information out to residents, businesses. We can use similar platforms like that. We haven't been at the point of needing to do that, but whether it's related to this current, the COVID-19 or whether it's flood related, we have systems that we can contact individuals and residents and businesses in our community.
And piggyback on that, Joe, we have been in communications with our 911 department. They kind of run that reverse 911 code red system. If we need to get to it, how to access it, and not even, we use it quite a bit internally here as well. But as Todd said, we're not to the point where we feel it's needed at this point, but we do have those mechanisms in place and could use them if need be. Go ahead, Joe.
All right, we are actually near the end of the list, or at least the ones that I can see without stalling for time too much here. What would need to happen to change the suggestion to stay at home, change it from a suggestion to something that's mandatory?
I'm looking at the group. Mayor Brown, would you like to tackle this one first? Go ahead, Mayor.
Deb Swanson, I think we would do with her. I'm sure there are CDC guidelines and we would follow those, and then she would be the one to help us interpret those guidelines, as well as Altru would be in the loop to see who's mandatory to stay home, who would we have to quarantine.
Okay, and since he mentioned you, Deb, I'm unmuting you as well. Deb Swanson, do you have anything to add to that? Oh, I apologize. Hold on, Deb. There you go. Go ahead.
Yes, the highest level of concern and warning is what we call shelter in place. It's usually used for different types of disasters than this, but that would be the highest level of caution that we would give to our residents. And that would not be done without some serious consideration of all parties involved. And there would be determinations as to who are the most priority workers. Sorry about that. It's my
Okay.
health telling me they're closed.
All right. Thank you, Deb. And you can take that phone call now, Deb. Apologize about that. And I'm also jumping here to Dr. Deere real quick. Mayor did mention just in consultation on that question, if it gets to a shelter in place, Altru's involvement.
Yeah, we'd be following closely with our local health department, as Debbie said, as well as CDC and North Dakota Department of Health guidelines.
Thank you, Josh. Don't see any other hands raised. Joe, I'm back to you.
All right, I think I got two left here, but I apologize. I'm worried that there's someone just seething right now because I didn't get to their question. But is the COVID-19 illness, is that airborne? And if I wear a mask, does that protect the public in case I've got it and I don't know it? Those are kind of two combo ones.
Sure. Dr. Deere, I'm starting with you on that one.
Yeah, so from as you know, COVID's a new illness to the world. And what we know about it is that it is primarily droplet, meaning larger air particles contain the virus with mucus, and they end up in someone's mucous membranes. Other ways to pass it are by touching hard surfaces where the virus can stay alive for hours, and going and touching your mouth. Those are the most common ways. As far as the mask is concerned, the CDC has a good one-pager website that says if masks are beneficial and who should be wearing them. So I'd point people to that website because they've been updating and doing a great job with that.
Thank you, Dr. Deere. And I'm not sure, Deb Swanson, is there anything to add to that?
I would just add that we are inventorying supplies so that we can make sure we can backfill some of those critical workers like EMS. And we are working with emergency management to make sure that the personal protective equipment that's needed by those critical workers is available to them based on their risk. And I agree with everything that Dr. Deere said about the spread of the disease. While masks are really important, it's that hand washing that can be so very critical, and then not touching your face, because that's exactly what we know about this virus. That's exactly how it is spread.
Thank you, Deb. Joe, I'm unmuting you one last time. You said you maybe
All
had
right.
one more.
No, I think I got them all. I apologize to anyone whose question I didn't get to. This was not as organized of a Google Doc as I thought it could be. So feel free to yell at me from a socially acceptable distance.
That's right. Thank you, Joe. And thank you to our panelists for being on here. The good info going out there. And as we said, this is changing. This is changing by the hour. So thank you very much for that. And just a quick.
Deb have another?
I apologize, Mayor.
I saw Deb raise her hand.
Oh, I'm sorry, Deb. Thank you very much. Deb, did you have anything to add?
I just have one last message, and that is we're monitoring calls into our department as well as social media, both our own and others. And some of the concerns that we're seeing is that people are not staying home if they're sick. It's really important that they do that. And also the social distancing. Think about whether or not you really need to go out. And if you can do something at a distance, that would be preferable. And so we just need everyone's cooperation in this and everyone's encouragement to their circle of influence to abide by what we know works to stop the spread of this disease. Thank you.
Thank you, Deb. And Mr. Mayor, would like to end it with you, if I could. One thing I want to speak to just real quick is our resources on the website. And Mr. Mayor, if you could touch on that a little bit, of the things that are available to the general public electronically anyway on the City of Grand Forks website.
Yeah, so please check our website for the latest information and the latest correct information. We realize that we have three things going on right now. We have a COVID-19 challenge, we have a flood fight challenge, and an economic crisis pending in our community. And so I encourage you to use the city website to see what resources we have, because there's a business listening sessions next week you might want to attend to find out what's going on in our economic community, as well as what's coming up in our impending flood fight, as well as what sources we have available for our COVID-19. So please check grandforksgov.com for the latest information.
Thank you, Mayor. And thank you to everyone else. As I'm looking across here, Dr. Deere, do you have anything to add, or are you good? Or Dr. Deere is good. Mr. Phelan? Mr. Phelan just gave me a thumbs up. Ladies and gentlemen, thank you for joining us for this virtual press conference. And this is how we're going to be handling our news conferences in the future. And this is our second one. We will be alerting them to the media as they happen, as they are needed, and but expect them in the afternoons at about this time. So thank you very much, and thank you for joining, and thank you for watching on Facebook, and thank you for watching on Channel 2. Appreciate it. Thank you.